A very good evening to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out the first varicose culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in ARV segment and present in around 50 countries. 3 state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. Coming to our vision, mission, and values. Our vision is shaping global healthcare by spearheading the One Health initiative, while our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched flagship brand anti-rabies vaccine Abhairab in an eco-friendly pack. And with this, we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market the products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted 2 government schools in Karkapatla facility and totally revamped the facility and given private infrastructure to these government schools. And with our intervention, the strength of these 2 schools have been doubled. Our other program is Gift Milk Program. In coordination with NDDB, we are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. And as we know, we are into field of rabies. We have tied up with FIAPO, Federation of Indian Animal Protection Organization, to make Thiruvananthapuram rabies free. You can follow us at and visit us at www.indimmune.com. Our toll-free number is 1-800-313-999977. You can also follow us on LinkedIn, Twitter, Facebook, Insta, as well as Twitter. You can visit us at www.fearlessagainstrabies.com and www.pubertytomenopause.com. And with this, I welcome our today's speaker, Dr. Saloni Chopra. Welcome you, ma'am. We are so pleased to have you today with us on our live talk show. We Talk to You.
Thank you so much. I'm also very obliged that you have, you considered me for this thing. so that I can, just give a general idea to the public what is basically this problem is and how basically it affects the
Yes.
general population. It basically, this problem not only affects the females of the middle age, it also affects the girls also. So
Yeah.
we can
Dr.
start the
Saloni,
treatment and
yes,
everything from
yes.
the starting.
Yes. Doctor, with your permission, I would like to introduce you to our audience. They might be excited to
Absolutely.
know about you as well. Dr. Saloni Chopra is an enthusiastic young gynecologist who has 6 years plus experience in gynecology segment, including high-risk pregnancy, various obstetrics and gynecology surgical procedure, instrumental delivery and infertility, etc. She has assisted various major gynecological operations and laparoscopic assisted procedures. She has a good experience of clinical teaching of undergraduate MBBS student. She has worked round the clock in handling emergency cases as well. She has participated in seminars and clinical case presentation and has also attended various postgraduate teaching programs including seminars as well as CMEs in obstetrics and gynecology segment. She has attended several, including emergency, obstetrics, cervical carcinoma, and high risk pregnancy topics as well. She has also worked on the fetal monitoring and has presented various paper presentations and poster presentations in conferences. She is an active member of FOGSI, AOGD, as well as IMA. Dr. Saloni, we are so pleased to have you today in our show. And as our topic is there for today's discussion, that endometriosis diagnosis and treatment. So, would request you to give an overview to our audience on the topic itself. Over
See,
to you.
endometriosis is something which is very difficult to understand, very difficult to treat, very difficult to even diagnose. Because the problem which female faces with this is a general problem sometimes, and people of our society consider it कि अच्छा ये तो होता ही है, or this is basically normal, ये तो चलता ही है. So that's why diagnosis of endometriosis becomes very difficult. People came for the problem with the problems after a very long time when they think कि हाँ अब चलो बहुत time हो गया, it's been long time that we have been suffering, अभी हमारे को ये भी दवाई ले ली, ये भी ले लिया. They go to multiple doctors. Finally they think of going to a perfect place कि भाई अब we need to, right now we need to go for the treatment for it. Basically, endometriosis is seen in all age groups. It starts from the adolescent girls. It is majorly seen in the reproductive age group, but approximately you can say 2 to 10% of the population of the female population is affected by endometriosis, and almost 50% of the females who are suffering from infertility is having endometriosis basically. And approximately in average, if we see, almost 190 to 200 million women worldwide is suffering from endometriosis nowadays. But it is not that all the endometriosis is symptomatic. So many patients have no symptoms. They have mild symptoms, and but it hampers their quality of life. It hampers their sexuality. It hampers their pregnancy. It hampers not only their life but also the people surrounding them. Like overall, their socializing becomes very difficult because of this particular problem.
Right. Dr. Saloni, for the benefit of our audience, can you just explain in very simple terms, like endometriosis hota kya hai? Exactly.
एंडोमेट्रियोसिस बेसिकली कुछ नहीं है, इट्स अ इन्फ्लेमेटरी कंडीशन जिसमें कि हमारी यूट्रस की एंडोमेट्रियम लाइनिंग होती है विच जनरली शेड्स ड्यूरिंग हमारे पीरियड के टाइम पे. बेसिकली व्हाट वी गेट ब्लीडिंग थ्रू द पीरियड टाइमिंग इज बेसिकली द एंडोमेट्रियम लाइनिंग, बिकॉज यूट्रस हैज थ्री लाइनिंग्स: एंडोमेट्रियम, मायोमेट्रियम, पेरीमेट्रियम. So the myometrium and the perimetrium are the internal linings, and it is the endometrium lining basically which sheds out. Sometimes there are multiple theories of endometriosis कि ये क्यों होता है, क्या है इसका रीजन. बट द मोस्ट कॉमनेस्ट जो हम सम पेशेंट को भी समझा सकते हैं बेसिकली इज दैट कि रेट्रोग्रेड फ्लो. जब हमारी एंडोमेट्रियम लाइनिंग नीचे से निकलने की बजाय, फ्रॉम आवर विजाइना बाहर निकलने की बजाय, वो तो निकलती है बट अलॉन्ग विद दैट इट गोज थ्रू आवर ट्यूब्स to the ovaries and to our abdominal cavity basically. So वो जो endometrium के जो tissues होते हैं basically they go there, and that causes chronic inflammatory. So imagine that all your this endometrium which was supposed to come out has started to go backflow. वो basically backflow भी कर रहा है. So because of that, what happens is this blood which goes, it starts getting collected in the ovary and causes, endometriomas, basically. That is called as chocolate cyst. That bleeding goes and get collected there, and eventually every time patient is going to bleed, the bleeding is going to get collected there, right? And along with that, all that endometrium के जो spots हैं, वो हमारे एब्डोमेन में भी चले जाते हैं. अब एब्डोमेन में तो बहुत सारी चीजें पेट में, हमारा वहाँ पे इंटेस्टाइन भी है, हमारा वहाँ पे यूरिन का ब्लैडर भी है, हमारा वहाँ पे यूट्रस के आसपास के लिगामेंट्स भी हैं. तो बेसिकली वो वहाँ पे जाके सारे चिपक जाते हैं, राइट? एंड ऑल दीज थिंग्स आर एस्ट्रोजन डिपेंडेंट, हार्मोन डिपेंडेंट. एंडोमेट्रियम लाइनिंग इज हार्मोन डिपेंडेंट. मेन हार्मोन उसका एस्ट्रोजन होता है. तो बेसिकली जब भी पेशेंट को पीरियड आएंगे, whenever the patient is going to bleed, patient is going to have pain and all the symptoms of endometriosis, which I'm going to discuss further.
Yeah. So Dr. Saloni, how endometriosis is diagnosed? या फिर आपके पास जो भी patient clinically land करता है, so what all complaints they have? Like क्या उन्हें sufferings ऐसे होते हैं so that they come and visit you for endometriosis?
See, basically endometriosis में हमारे there are some 4-5 Ds which we actually figure it out. First is dysmenorrhea. Dysmenorrhea means pain when the patient is having periods, severe pain, which can start prior also. Patient can have pain during the periods time also. Patient can have pain after the period also. So pain is the most important point which we have to consider when the patient is having severe pain during menstruation, pre or post menstruation also. Then there is dyspareunia. Dyspareunia means when the patient is having sexual activity and they feel too much of pain. Without any reason, they will have too much of pain and they were not able to, have a good sexual life. Then we have basically dysuria. Dysuria means when they have while passing urine, while they have pain while passing motion. They can have bleeding while passing motion, basically. While passing urine, they can have bleeding, hematuria. And all these, they can have cyclical pains. Every time they are going to have bleeding, they can have cyclical pains. Even the endometriosis can even go to your chest also. So they can have cyclical coughing, cyclical pneumothorax. All these are basically the symptoms. But the main symptoms patient comes with is dyspareunia, dysmenorrhea, dysuria, dyschezia, and mainly infertility. When infertility के साथ में उनको ये वाले कोई भी एक आधा symptom जरूर होगा कि periods के time पे pain और हमारे में basically difficulty हो रही है, हमको conceive नहीं हो रहा है. So majorly patient इन symptoms के साथ में आता है.
So Dr. Saloni,
so the diagnosis is
yes, Dr. Saloni.
I guess कुछ streaming issue आ गया बीच में.
You are audible, ma'am.
I'm audible? Okay, fine.
Yeah,
so basically these are the symptoms जिसके लिए patient हमारे पास में आता है. These are the complaints जिसके लिए patient हमारे पास में आता है. And your next question was कि how do we diagnose it? सबसे पहले तो हमारे को clinical examination करना होता है. We have to check patient vaginally कि when we are inserting the fingers, can we feel any nodules or patient is having any pain or something like that. Then second step comes out to be the हमारी investigation, which includes imaging techniques. Imaging techniques में हमारा सबसे best जो आजकल है, that is a transvaginal ultrasound. If transvaginal ultrasound does not work for the patient, we can go for the transabdominal, because the patient who is unmarried and having this problem and sexually non-active हैं, तो उनमें हम transvaginal नहीं कर सकते. In those cases, we have to go for the transabdominal ultrasound or transvaginal ultrasound. And the last thing is that if we have any doubts and we want to confirm, then we can go for the MRI. Previously, long back, like few years back, the gold standard diagnostic technique was laparoscopy, like what in layman language we say दूरबीन वाली surgery, जो हम हिंदी language में patient को समझाते हैं कि हम दूरबीन से देखेंगे. So that is laparoscopic surgery used to be considered the gold standard, but not now. Not now. The guidelines have changed. They are saying that laparoscopy should be done only if the we are suspecting endometriosis, we have given the treatment for it, or in the imaging techniques we are seeing endometriosis, but still either the patient is not responding to the treatment, or either there is something in the MRI or in the ultrasound which requires surgery, then only we have to go for the diagnostic laparoscopy, in which we confirm yes कि हमें दिख रहा है कि हमारे को endometriosis है. But directly हम किसी भी patient को laparoscopy के लिए direct advice हम नहीं करते. पहले हम we go for the investigations, imaging techniques, confirm कि we are suspecting, we give the treatment. If treatment is not working, then only we go for the laparoscopy diagnosis of the patient.
Okay. Dr. Saloni, at the start of our session, you were talking about some complications related to pregnancy or IVF sort of things. So, can you just let us know how endometriosis is linked to both these conditions?
See, basically, what happens when we have endometriomas, when we have this endometrium linings, what it does is it causes a lot of adhesions. Our uterus, ovaries, it all gets stuck together. It becomes like a frozen pelvis. So basically, endometriosis में stages होते हैं. There is stage 1, stage 2, stage 3, stage 4. When it is only, near the ovaries and all, it is around stage 1. When it goes beyond the tubes and everything, it becomes stage 2. When it involves our all the ligaments of the uterus and all, it becomes stage 3. When it basically involves all our bladder also, rectum also, all those areas like chest involvement happens, then it becomes stage 4. So it goes from stage 1 to stage 4 slowly over a period of time. But basically why we are talking about is mainly is the infertility. One is the pain. Because of pain, patient is not able to have sexual activity, so they will not be able to conceive. Even if that is not the scenario and they are trying and everything is happening fine, but what happens is, because of all the adhesions, the pregnancy will not happen, the eggs won't rupture, the ovulation won't happen. If ovulation happens also, then sometimes there is more chances of ectopic pregnancies, because tubes get adherent to each other, and tube is the main organ where a pregnancy formation happens. So if the pregnancy is happening also, but because of some reason it can go into ectopic pregnancies, it can go for miscarriages also. So if we talk about it, if the patient gets pregnant, then in the first trimester it can cause ectopic pregnancies, it can cause miscarriages. And in the second and the third trimester, after 12 weeks, patient can have these complications which I'm talking about are less chances, but it can happen. They can have diabetes, they can have hypertension, they can have placenta previa, where the placenta formation is lower than its position. Then it can cause abruptions also, more chances of cesarean and stillbirths, more chances of IUDs, very less of the chances, but it can happen. And so this is if the patient conceives. Then basically first we'll talk about what problem we can have before conceiving. Is because of the adhesions, conceiving won't happen. Because of the endometriomas, follicle won't happen. So in these cases, basically we have to go for the IUI procedures, or we have to go for the IVF procedures to help the patient to conceive. So this is one thing. So if the patient is coming with infertility and we diagnose them, the patient is having endometriosis, first thing is that we should not give any medication to suppress their ovulation. Okay, we should not give any medications to suppress their ovulations. And even we should not go for surgery directly. Like if they have endometriomas, like I talked about, ki ovaries mein chocolate cyst ban jate hain because of this thing, and the cyst is there in the ovaries, and then basically उसमें फिर eggs वगैरह नहीं बनते हैं. तो अगर हमें पेशेंट को कंसीव कराना है, तो ऐसा जरूरी नहीं है कि हमें पहले पेशेंट को ऑपरेट करना पड़ेगा, फिर उसके बाद हमें पेशेंट को we have to try for the IUIs and all. If the patient have endometriomas also, without going for the surgery, we can still plan for the conceiving. We can go for IUI procedures where we insert the semen of the husband directly by making the egg formation in the ovaries. And there is, if required, we can go for the surgery. If the patient is having too much of pain, and or if the follicles, which the egg formation which happens in the ovaries, we are not able to access it, then only we have to go for the surgery. But prior to giving any conceiving treatment, there is no indication that we have to plan for surgery, remove all endometriosis, and then go for the IUI or anything like that. It is not indicated. But if we are planning, if the patient is having too much of problem, too much of symptoms, too much of cyst, too much of everything, we can plan. And then after doing the surgery, we can remove all the endometrium lining, like endometrium spots which are there, like endometriomas ko hum nikal sakte hain. We can go for the cyst removal. We can go for the excision of all the endometrium spots. And then we can ask the patient to plan immediately. Like we can directly ask the patient कि आप immediately आप conceiving के लिए या तो naturally try करो, या हम आपको treatment देंगे conceive करने का, or else we can go for the IVF procedures for them.
Dr. Saloni, sometimes it has been, discussed, or it has been seen that after hysterectomy also endometriosis chances are there. So is this true, or matlab it's just a myth?
See, basically, if the patient is already having endometriosis and they are being given treatment, their family is complete, but they're diagnosed with endometriosis, and we go for the hysterectomy for the same problem. कि okay, हम uterus निकाल देते हैं, tubes निकाल देते हैं, ovaries निकाल देते हैं, तो ये शायद problem ठीक हो जाएगी. But this is not true. If the patient is having endometriosis, it is, I already told them कि endometriosis is not only to the uterus and the ovaries or the tubes. It can go to your abdominal area also. From there, it can go to your rectum also, intestine. It can go to your bladder also. It can go to your chest also. So if we are removing the uterus and the ovaries, it does not mean कि हम बाकी सारे जो problem है, बाकी जगह पे अगर endometrium spots हैं, तो वो हम रिमूव कर रहे हैं. इट्स नॉट लाइक दैट. तो
Yes.
ऐसा नहीं है कि भाई हमने यूट्रस निकाल दिया तो हमारी प्रॉब्लम क्योर हो जाएगी. पेशेंट कैन
Mhm.
स्टिल हैव पेन, patient can still have symptoms, and patient needs to be given therapy. Like अगर हम उनको before menopausal age से पहले अगर उनका यूट्रस निकाल देते हैं, so we have to give them the hormonal therapy so that the post menopausal symptoms should not happen.
Yeah.
And if we are planning for hysterectomy for any patient because of the endometriosis, we have to go for the total hysterectomy. Like nothing should be left behind. Like the uterus, the cervix, the tubes, the ovaries, everything should be removed. And along with that, we can also remove the spots which we are seeing around them. We can do the excision of all the endometriotic tissues which is there lying inside, which can cause pain later on. We can plan for that kind of surgery, but the 100% cure is not mandatory.
Yeah. Dr. Saloni, what are the current treatment options? और whenever a patient visits you, तो आप किस तरीके से treatment शुरू करते हो? Already you have told some things, but if you can just
Mm-hmm.
let us know in detail.
या बेसिकली क्या है, मेन प्रॉब्लम आपको बताया पेन है. पेन के साथ ही मेन का सबका मेन प्रॉब्लम ये होता है, पेन होता है, पेन है, बहुत पेन है, बहुत पेन है, राइट. सो बेसिकली पेन के लिए हम पेशेंट को पेन किलर्स दे सकते हैं, एनाल्जेसिक्स होते हैं, एनसेड्स होते हैं, वी कैन गिव टू द पेशेंट फॉर दैट पेन. बट अलॉन्ग विद दैट जो मेन हमारा ट्रीटमेंट होता है, जो हमारा अपार्ट फ्रॉम दी सर्जिकल ट्रीटमेंट, द मेन ट्रीटमेंट इज द मेडिकल मैनेजमेंट. हम चाहते हैं कि मैक्सिमम हमारा मेडिकल मैनेजमेंट से पेशेंट हमारा ट्रीट हो जाए. उसमें सबसे इंपॉर्टेंट फर्स्ट थिंग इज दी contraceptive pills, combined contraceptive pills which contain estrogen and progesterone both. So this can be given for dysmenorrhea, dyspareunia. We can give the patient कोई non cyclical pain है, अगर periods के time पे pain है, otherwise भी अगर patient को pain है, तो we can give combined oral contraceptive pills. We can give, second thing we can give is progesterone. Nowadays, basically, if I talk about recent times, what we give to the patient, if the patient comes with endometrium or endometriosis or adenomyosis, we give them Dynogest. Dynogest is the drug of choice nowadays, which is basically the progesterone hormone, which basically causes suppression of the ovulation and everything, and causes stoppage of the periods. Once period stops, so the tissue becomes, and the size of the endometrium starts to suppress. And the second line, this is the first line, basically contraceptive pills, either combined or we can give just only progesterone hormone. The second line of management is gonadotropin releasing hormone agonist, but it has its own side effects. It has to be given only if the patient is not responding to Dynogest, or if the patient is not responding to combined oral contraceptive pills, then only we have to go for it, because it causes demineralization of the bone over a period of time. So beyond 6 months, it becomes very difficult because it can cause loss of bone mineral density and weakness of all the bones and all. So even if we are adding GnRH agonist, we have to add along with that contraceptive pills, add back therapy, so that patient should not have all those symptoms. And surgery, if I have already informed you that surgery is the last resort. Surgery should not be the first resort. Unless and until patient is having not responding to the medical management, then only we have to go for the surgery. And few things we have to keep in mind in during the surgery is that when we see endometriotic spots in the abdominal cavity, we have to not causes cautery or ablation. We have to remove all those spots. That should be the point. First thing, the cautery will not help. It will cause more pain later on. Second thing, if we are removing the endometriomas, the endometriotic cyst formation, which happens in the ovaries, if we are planning for that, then we have to do cystectomy. We should not do only the drainage कि हमने बस drain कर दिया और सारा उसका fluid बाहर आ गया. हमें proper, we should try कि हम पूरा cyst निकाल दें, and we should do minimum damage to the ovaries. Basically, why we don't prefer the surgery before conceiving is because when we go for the cystectomy in endometrioma, ovarian damage happens. The ovaries का जो हमारा reserve है, the ovaries के जो follicles हैं, वो damage हो जाते हैं. So it becomes half. So chances of conceiving sometimes reduces, sometimes increases. That's why there is it's a very controversial topic कि भाई सर्जरी करें या ना करें. अगर करते हैं तो cyst removal करना है, drainage नहीं करनी है. That is the important thing. And sometimes if the patient is having deep endometriosis means over the ligaments of the uterus and over the bladder and everything. If we remove that, we can remove that because that reduces the pain, but it does not increases the fertility chances. Just the pain reduction happens.
Okay. Dr. Saloni, many of the things are now linked to the lifestyle changes, right?
Yes.
So, is endometriosis also linked to somewhere lifestyle changes? If a girl or a lady or a woman, if they do some lifestyle changes and they, adapt their daily routine, a good schedule, and all those things, does it help in overcoming endometriosis?
See, what I believe is lifestyle changes is the baseline of everything. कोई भी किसी को भी कोई भी प्रॉब्लम है, चाहे डायबिटीज है, चाहे हाइपरटेंशन है, चाहे कोई भी प्रॉब्लम है, चाहे इनफर्टिलिटी है, चाहे एंडोमेट्रियोसिस के कारण भी नहीं है, फिर भी इनफर्टिलिटी है. Lifestyle matters a lot because what you're eating, what is going into your body, what is going into your blood. Basically, blood is everywhere. So, if you have a nutritious diet, you eat healthy, you take a lot of antioxidants, then obviously blood flow goes to your uterus and everywhere. So, definitely it does help. Lifestyle modification may obviously if the patient has regular routine of exercise and doing something for at least half an hour in a day, तो वो तो definitely help करता है. Exactly, I won't say कि endometriosis इससे ठीक हो जाएगा, but yes, overall patient की fertility, pain, everything becomes better if we have good lifestyle, if we have good nutrition.
Yes, means ma'am, symptomatic relief if we say. In that,
Yes,
it can
absolutely.
help. It can help. Thank you so much, Dr. Saloni, for giving us such an elaborative and in a very simple way, you have explained us what is endometriosis, how the symptoms and all you person can diagnose, as well as the treatment. Doctor, it's time for us to take few questions.
Absolutely.
One of our viewer is asking, Doctor, I am
Hmm.
having irregular periods as well as heavy
Hmm.
flow
Hmm.
during my menstrual cycle or periods. So, is this a sign of endometriosis?
Endometriosis में sometimes periods are regular. The main patient का complaint is कि भाई it is too painful. ठीक है, the flow does not basically changes with endometriosis, but yes, as I told कि हमारा जो imaging technique है, ultrasound, transvaginal ultrasonography, basically that is one thing which diagnoses endometriosis, and this is one diagnostic imaging technique जो हमें कोई भी problem बताता है कि हमारे periods में irregularity और heavy flow किसके कारण है. There are multiple reasons of it. So endometriosis can be one of it, but not exactly. You can have fibroid, you can have PCOD, or you can have adenomyosis. Anything can be the reason of it. So it's better if our viewer go for the transvaginal ultrasound, get a consult with the nearby gynecologist. So I guess that will be the better option for the patient to confirm कि उनको what problem she is suffering from.
Uh, Doctor, one of our viewer is asking that she had her first baby got delivered, and then after that she was continuously suffering from painful intercourse. Means whenever she might
Okay.
be having intercourse, she is
Hmm.
feeling pain. So, is it a
Hmm.
sign of endometriosis?
Uh,
Should she consult her gynecologist?
See, sometimes yes, if the patient has undergone for any cesarean and all, they can have scar endometriosis. Like the endometrial tissue can come out of the scar, like the incision which we give over the uterus. From there, the endometrium tissue can come out and it can get attached to the scar of the patient abdominally, inside. Outside आपको feeling नहीं आएगी, but inside. So that can cause, yes, it can cause cyclical pain. जब आपको periods आएंगे तो cyclical pain हो सकता है आपको scar site पे. आपको regular intercourse में भी pain हो सकता है. जरूरी नहीं है कि आपकी first pregnancy normal हो गई तो you cannot have endometriosis. Endometriosis can happen anytime. वो कभी भी हो सकता है. Retrograde flow of your menstruation can happen anytime. So yes, patient can actually go for it and confirm कि उसको endometriosis है या नहीं है.
So it's always better to consult your gynecologist if you are finding
Absolutely.
anything unusual, right? So,
Obviously, this is a very important role part of the female's life. अगर ये में balance disbalance हो जाता है तो I guess the whole cycle goes bad. आपके mood swings, आपकी family gets
yes.
affected by it, आपकी sexuality gets affected by it. So basically ये तो it's a core of everything.
Yes. And Dr. Saloni, I think it is a kind of responsibility, at least for all educated girls and women across the country, that they should check their health from time to time. And if they find anything
Absolutely.
going abnormal or anything which is not usual, they should definitely first of all consult a gynecologist rather than taking medicines on their own.
Yes,
So
absolutely. Because some things can be diagnosed at the initial stage, can be treated at the initial stage with medical management. And if we
yes.
don't, go at the right time, at the right place, then basically we land up ourselves in future problems, जिसमें फिर हमें सर्जरी ही करानी पड़ जाती है actually.
Yes. One more question, doctor. Uh, I am suffering from urinary tract infection from last 3 months and having pain in my abdomen. Should I have chance of getting endometriosis?
Yes, but then only the urine problem is not the main symptom of endometriosis. As I already informed, the endometriosis में dysmenorrhea is one of the major symptoms. Patient will have pain during menstruation, and
Yes.
along with that, they can have other symptoms like sexual activity में pain, urine में pain. This can be added on symptoms, but the main symptom is dysmenorrhea, like pain during menstruation. If the patient is having that also, along with that recurrent UTIs and recurrent pain, then yes, patient needs to be get treated.
Okay. Thank you so much, Dr. Saloni. Till for now, we have these many questions, and if any more question comes, then we will definitely come back to you and have an
Thank you so
interaction with you
much.
regarding this. So once again, Dr. Saloni, thank you so much for being here with us and giving your valuable time and suggestions, as well as your expert guidance. So
Thank
once
you so
again,
much.
on behalf of Puberty to Menopause, a Women Health Awareness Initiative by Human Biologicals Institute, I wholeheartedly thank to our expert doctor as well as to all our viewers. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life, and follow us on Facebook, Twitter, Insta to get more updates on health. If you want to have any more questions on endometriosis, you can definitely ask Dr. Saloni. You can write in the chat box, and we will definitely get back to you in support with and guidance with Dr. Saloni over here. Thank you so much, ma'am, and thanks to all the viewers once again. Have a very nice evening. Thank
Thank
you.
you. Good evening.